Today we're going to talk about options that we have for additional evaluation of patients who have dense breasts or are high risk for breast cancer. And we all know that mammography is the best we have, but it's not great. So I'm excited to think about what things we have besides imaging that we can use to help us further stratify our patients and understand maybe who are the right patients where additional imaging might be helpful. We know that ACOG does not recommend additional imaging even for patients with extremely dense breasts. So Certitude is a blood test, simply performed in your office or in the lab. It measures proteins that tell us something about the biology of what's going on in her body. And what's so great about that is that it's telling us what the body is responding to. It's not just looking at a lesion, but it's saying the body's responding to this in some way. So the proteins that are in the body are measured by this test, and that can tell us with 99% confidence when it's negative that she doesn't have cancer. If it's positive, then that means she's the right patient to go on for maybe ultrasound or MRI. But with a 99% negative predictive value, we can confidently look our patients in the eye and say, even though your mammogram showed you had dense breasts, this is good for this year. Certitude is different from hereditary genetic testing in that it's measuring proteins in the blood. It's not measuring the DNA or the genetics or someone's predictive risk of cancer. It's actually measuring what's going on in the body right now, not her future risk. So the genetic testing informs risk, right? BRCA1, BRCA2, PTEN tell us that someone is at high risk to develop cancer. The proteins are telling us what the body's doing right now, what's happening in the body. And so it's a much different kind of testing. It's not for prediction of risk, it's for identification of those patients that deserve additional screening or diagnostic testing. So Certitude is really different from the other liquid biopsy tests that are available on the market right now. Those tests look for circulating tumor DNA to highlight whether a cancer is present, and they're looking for multiple different cancers. The problem is many early cancers, including breast cancer, don't shed tumor-specific DNA, and so these multi-cancer early detection tests don't actually detect breast cancer early. They in fact find it quite late. And that's because breast cancer doesn't shed DNA. Certitude is a proteomic test. It's looking at proteins in the blood that are telling us what's happening right now and how her body is responding. So it's a much earlier test, a much different test, and really specific to breast cancer. So for those of us clinicians who are dealing with patients who've now seen their mammogram report and they know they have dense breasts, what do we have to offer? The Certitude blood test is far more reliable than the mammogram for those patients. For those patients, mammography is only maybe 40 to 50% sensitive, although it's quite specific. The Certitude, the proteomic blood test, gets us a much higher sensitivity and a negative predictive value at 99%. So if it's negative, we can reassure these patients that they very likely do not have breast cancer. So a negative predictive value is so important for us to understand. What does that mean when we say that to a patient? Patient doesn't know what that means. Most of us don't really know what that means. What it means is probably less than 1 out of 100 patients who have a negative test will actually have cancer. That's far different than what we're finding, for example, with MRI or ultrasound, where we have all of these false positives. This is our opportunity to be able to tell a patient with 99% reliability that she doesn't have cancer. There's no test that's 100%, but this is the very best that we could ever hope for. Fewer than 1 out of a few hundred patients will have a false negative. Certitude actually performs really well across all types and stages of breast cancer. So unlike the multi-cancer early detection tests that are looking at DNA and the tumor has to be shedding DNA, the proteomics really allow us to find in situ cancers and the difficult to find cancers like lobular cancers, difficult to palpate, and they don't show up very well on screening imaging. So it's a great test to be able to stratify patients and be confident that across all stages we can pick up early cancers. Certitude is a great stratifier for us. It's a great test for us to use for those patients who have dense breasts to be able to determine whether they should get additional screening or additional diagnostic testing. It has value across all stages. We can even find stage 0 breast cancers. We can find lobular cancers that are very difficult to see or appreciate on imaging. So by using proteomics, we're able to stratify patients into those who really should have additional screening. Blood-based testing really should be an adjuvant. It should be an addition to guideline-driven screening imaging. So mammography is still the guideline, it's still evidence-based, but we have the conundrum, we have the problem of women with dense breasts where mammography is just not that helpful. And so blood-based additional testing can help us then stratify the patients into those who need additional testing and those for whom we can give reassurance that all is well. So for my practice, Certitude is a great way to stratify patients into those who need or deserve to have additional screening or testing and those who don't. So half of our patients have dense breasts, at least heterogeneously dense breasts. And I'm not going to send half my population for MRIs or ultrasounds, especially when they have to pay for all of that. So to me, this is a great way. Certitude is a wonderful opportunity to be able to stratify those patients into those who really deserve the additional testing. Certitude is a blood test, like any other blood test that we order from the clinic. Whatever the workflow is for your clinic would be the same workflow to order Certitude, even though it's a new test. So it doesn't add additional strain to what's already happening in the clinic. To learn more, visit certitudetest.com.